everyone. It's Laura Mitchell reporting to you live from the CES 2016 Digital Health Summit studio. I'm here with my guest today, Dr. Michael Nova, and he is the Chief Innovation Officer for Pathway Genomics. Welcome to the show. Thanks for coming.
Thank you very much. My pleasure.
So tell us a little bit about what Pathway Genomics is doing.
Right, so we're a genetic testing company, and we launched at CES a consumer application where it takes genetic information and we couple it with Watson's cognitive healthcare and machine learning, so you can personalize insights for the user. As an example, you can ask it, what should I eat today? And if we have your genetic test and some Fitbit data or wearable data or some other type of medical information, we'll personalize that response based on the data that we get. So it's a very cognitive, dense consumer type application.
And so do you collect that data from multiple sources
Correct.
and then just sort of interpret what that means?
Correct. The interpretation is everything. You're
okay,
right.
So
right. And part of the help in the interpretation is through the cognitive system from IBM. We have a corpus or a piece of the IBM Watson system with our data in there and our interpretation stuff, and then the Watson element and our artificial intelligence. They learn from what's going on, with the personalized information that's coming.
Sure, that's fascinating.
Yeah.
So you were just speaking on the dawn of the cognitive era.
Right.
Tell us about that panel. What did we learn from that?
I think we learned that it's not all fiction anymore. So now we're launching an app, and Medtronic's did. There's other people that have been working on cognitive technologies with Watson over the last year. And now these apps are starting to come to fruition. Particularly in the mobile space, in the mobile area. Where there's a lot of uptake, for these types of applications in healthcare.
Okay, great. And so what is happening? What do we see in Pathway Genomics in the next 2 years?
Yeah, we're launching this application, and there isn't any denser data than healthcare data. It's the most complicated type of data. So this application will learn as it goes forward and ends up being your kind of personal wellness sidekick. Okay. Something that it's with you all the time and will tell you basically you should eat that or not eat that or do this exercise or don't do that. And it just gets better and better and more granular in the information that we can give back to the user.
That's excellent. Where do you see the digital health space going?
Yeah, I think, one thing that everybody has is a cell phone, right? They might not have a lot of the gadgets, the other devices that collect information, but the cell phone is becoming more and more powerful.
Sure, it's a hub.
It's a hub, for a lot of things. I mean, Samsung has got a cell phone that's got an infrared scanner in it and a glucose, not a glucose, but a blood oxygen monitor.
Sure.
It's got all this, and it's going to have more and more capability.
Yeah, just walking around the show floor, that's clearly the future.
So it'll be taking in a lot more data, but then interpreting that data is the goal. Is what do you do with that data? How do you give insight into the user? And it doesn't wear the user down. He's not interested in learning about certain very difficult medical problems, but he might be interested in, again, should I eat that avocado or not?
Yeah.
Right?
So it's turning it into actionable data.
Yes.
So where do folks go online to find you?
Yeah, we're at www.pathway.com, and you can learn all about our genetic testing and also our application.
Well, thanks so much for joining me. This is Dr. Michael Nova. He is from Pathway Genomics, live in the CES 2016 studio, Digital Health Summit studio. This is Laura Mitchell.